everything was perfect until I reached about my 35-36 weeks. Are you saying hi? Hi guys, I've been wanting to do this video for a real long time. Don't mind my kid coming in and out of the frame. He kind of like wanted to be in it, but he's not quite sure yet. So this is about my pregnancy story. I did had some complications, and it's something that is not really talked about. This kind of complications doesn't occur very often, and I really don't see anybody talking about it, maybe because it's not too common, but it's something I believe people should know about, just in case it happens to you, it happens to a friend, it happens to your cousin or somebody really close to you, and that way you will know or will give some advice to that person. I was trying to get pregnant for a whole year. We tried and tried, and because of an experience we had so anyway, because of experience we had in the past, I will ask my OB almost every time if she could see the baby, or if she could hear the baby, if the baby was okay, if he had a heartbeat, or if his heartbeat was good. So everything was good after a whole year of trying, pretty much, and he was there. It was clear that he was there. So through my whole pregnancy, everything was good. I had good blood pressure, the baby was good, until I reached my 35-36 weeks mark of pregnancy. I did started feeling itchy, like the palms of my hand, they were itchy, and the soles of my feet, and pretty much everywhere. It is normal to feel itchy on your pregnancy because your belly is growing and your skin is stretching, but it was not only on my belly or my arms or my back, it was pretty much like all over, but mostly it was on the palms of my hand and the soles of my feet. So I was like, okay, maybe it's just hormonal. I did ask my mom. I said, Mom, did you ever experience this when you were pregnant? She was like, oh yeah, I did, but you know, it's because of your hormones. Your hormones increase when you get closer to your due date. So I'm like, okay, so then I'm just panicking. But then the itching didn't stop, or it just didn't settle. It was just continuously being more itchy and itchy, and it was just feeling so uncomfortable, to the point that it will wake me up at night to itch my feet, and mostly the sole of my feet. It will wake me up, and it was so uncomfortable. So I was just so itchy, it was feeling really uncomfortable, and sometimes I couldn't sleep at night because of the same problem. So I believe on my 36-week mark, I did had an appointment with my OB, and I did tell her about it. I think it was kind of funny when we went and find out, because she had like an intern, I believe. She was practicing with me, having the conversation and pretty much explaining to me what was going on in that week. And I told her, I'm like, hey, you know, I've been pretty itchy. The palms of my hands are itching really bad, and the soles of my feet, and pretty much everywhere, but mostly the palms of my hand and the bottom or the sole of my feet. She was like, okay, once I go out there, I'll tell the doctor about it. I'm like, okay. So then she went outside of the room, and she did took a while, so I was like, okay, maybe this is just not normal. So then my OB came in with a intern or whatever, with a girl, and she's like, well, this girl's been telling me you've been having this itchiness. I'm like, yeah, it even wakes me up at night. And then the intern went like this to the shoulder of my OB. She's like, see, I told you. I was like, okay, is it good or is it bad? What's going on? So then I was like, okay, what is it? I'm like, is it bad or what's going on? She's like, the only thing I can think of is that you are developing cholestasis of pregnancy. I'm like, okay, and what is that? I'm like, does it affect me? Does it affect the baby? She's like, it doesn't affect really you, but it does affect the baby. So I'm like, okay, so that's just great. So I'm like, okay, so then what is cholestasis of pregnancy? So I do remember a little bit of what cholestasis of pregnancy is. Pretty much is very severe itchiness throughout your body, but mostly on the palms of your hands and the soles of your feet. And I did research it, and it is is a common liver disease that only happens in pregnancy, which also when my doctor said that once the baby's born it'll go away, but every time I get pregnant I will have this symptom. So every time I get pregnant I will have to tell them when it's starting so they can do something about it. So it usually happens on the palms of your hands or soles of your feet. Oh, and it is also common on the 3rd trimester of your pregnancy. So, it's kind of right, because throughout my whole pregnancy I was feeling fine. I felt itchy, but not as itchy. It would feel just like normal itchiness, you know, like it's just here and there in my belly, but it was about it. It wasn't feeling too bad to the point that I couldn't sleep at all. But he says that it may feel worse when you get closer to your due date because of your hormones increasing. So yeah, the causes for it, they don't really know. They're just unclear, they said, and that's because it is usually, I believe, genetic. So like I said, I did tell my mom, but back in the day when I was born, I don't think they will know about it. And I mean, she only told me it was my hormones, so I believed her. I mean, it's my mom and she was pregnant with me, and she did say that it was normal. It was just itchiness because of my hormones, pretty much. But yeah, it does say that it's genetic, and if my mom had it, then I will have it, and if I had a daughter, they will have it. So it is normal. Which also my OB asked me if my mom had it. I'm like, I really don't know. I did ask her the symptoms about it, but she only told me that it was her hormones. So she did had it with me when she was pregnant with me, but she's like, back in the day she didn't know what cholestasis of pregnancy was, and a lot of people doesn't know what cholestasis of pregnancy is. So this is why I want to make this video so bad, because it happened to me. It can happen to my neighbor, or to my neighbor's friend, or to my neighbor's family member, and they don't know what it is. Why does the itchiness happens? I did research that, and that is because of group of liver disorders that interfere with the flow of bile. So when the blood deposits these bile acids into the tissues is when your itching starts happening. So also my OB said that if it will not do much to me, but it will do to the baby. The bile acids are going through your bloodstream and it's going into your baby. So if he would have got all of these acids, if I would have left it untreated, he would have got all of these acids of my bile, and he could have been a stillbirth, or he could went on distress, and that was not good, and my OB was pretty worried about it. So she told me, you know what, I can do a test, she's like, but the test to me is gonna take too long. I'm pretty sure you have this, so what we're gonna do is we're gonna induce your labor. I'm like, okay, so when is the baby coming? She's like, next week. And we're like, oh, next week. Like, okay. I mean, we were expecting him, but we weren't expecting him that soon. So we were pretty, I guess, surprised that he was coming that soon. So I did talk to my mom and told her about it. I explained to her what it was, and she's like, see, if I would have known about it, I would have do something, you know. I mean, I had it and I never realized it was that. I'm like, well, yeah, I understand, Mom, but back in the day, I guess they didn't have all this technology and research and stuff like that, so it's good that I was okay when I was born. So he did got induced next week. We did had a dinner before we went in, because my doctors told me to eat before I went in. So I'm like, okay. I did wanted to have a natural birth, but that didn't happen. We had complications, so I had to have a C-section. Oh, like 2 days after, I think 2 days, the next 2 days after that OB appointment, when she realized I had cholestasis of pregnancy, I did had to go in and say hi. Yay! So 2 days after my OB appointment, I did had steroids injected into me. I had them injected on my leg. It hurt so bad. I had to have 2 shots, one every 20. I had to have one injected every 24 hours. So it was one, and one day I think it was like 10 in the morning, then the next one at 10. So I did had to have that injected, just because in case I guess his lungs weren't all the way developed, so I needed to have this done for him, so he will have his lungs good, and he will have to be born with any complications. So I did had 2 of those. So the day that we had to go in to get my labor induced, I did had a family dinner. I did had a family dinner with my fiance's family and my parents. We went to a restaurant close to the hospital, literally across the street from it, which was pretty nice. So we didn't have to like go back and forth places. My delivery, it was pretty long. It was about about 2.5 days long. So it was really long. I pretty much just wanted him out of me. It was pretty long and not too miserable, but it was long. It was just too long, and we did have some complications. His heart rate was going down. I don't know if he was losing oxygen or what was going on. But before I knew I was gonna have a C-section, I did have an epidural, just because my contractions were just too bad. So I did have a C-section. Everything went well with my C-section. I think that was the best way to do it. My OB was awesome. I will want to go back with her if I ever get pregnant again. I think it was a really good choice with my OB. So yeah, my baby was born on February of 2017, and he weighed 6 pounds 12 ounces, and he was 19 inches long. So yeah, and you've seen him now since he's been in and out of my video. He's about to be 2 years old now. He's healthy, and that's all that matters. My baby's name is Axel Michaels. I did like Axel a lot, and it seemed like my fiance liked it too, so that's how we named Axel, but we do call him AJ. So here's my little AJ. Can you say hi? Say hi, guys. My name is AJ. How old are we gonna be? 2? Can you do 2? No, that's 5. Remember, we did 2s. 2! Yay! We got 2! So this is little AJ. He's got dark brown eyes and dark brown hair, and he's so adorable. So yeah, guys, if you hear of somebody complaining about it, or that they just feel too itchy to handle it, and if it comes mostly on the palms of their hands or the soles of their feet, you have to advise them to go and talk to their OBs, go and talk to the doctors, and tell their doctors. I mean, you don't have to tell them, but tell that person to go and get checked out, because it can end up bad if you leave it untreated. If you leave it untreated, your baby can be a stillbirth, your baby can get on distress, and like my baby, he was preterm birth. So it depends when you get your cholestasis or your symptoms and how bad they are. You want to get it checked out. So yeah. I believe that's it. If you guys like this video, please give it a thumbs up. This is my very first video, so I hope you guys liked it. If you liked it and you want me to keep doing videos, make sure to subscribe to my channel. If you did like this video and you want me to go in depth with my delivery story, I can do that. Just make sure to leave your comments down below and tell me if you like it, okay? So yeah, thank you. Bye.